everybody, and welcome to episode 44 of CCA's Medical Minute, sponsored by Kroger Health. And we are happy to be here today. I'm happy to be here with my colleague Jill Hunt and Sherry Hughes, our usual team. Sometimes it changes a little bit, but today we're going to talk about me. And we haven't done that since episode 39 and when we last updated. So I was coming from my house that day. I was all smiles because everything was fine and no problems whatsoever. And I still had my full head of hair. At the time, I was sitting in my wine cellar and all was good. And
Minus
so
the fact that you were the bubble boy that day.
I was so that's a great point. So I was under house arrest because my white blood count had taken a pretty serious nosedive. And so where we're at since then is that, in fact, at that episode, I just received a biosimilar for something called Neulasta, which was called Zarzio, which was like a 3-dose regimen.
And just to correct, Zarzio is a biosimilar for a medication called Neupogen.
Neupogen. Okay.
Neupogen and Neulasta are different. Neupogen is short-acting, and you have to get sequential shots, versus Neulasta is long-acting. You get one shot 24 hours after treatment.
And to update everyone, Steve is now undergoing chemotherapy for your elevated PSA levels, correct?
Correct.
And you're past the halfway point now, right?
I am
Excellent.
Now. I'm three full treatments in and on my way to my fourth. So, which I'm getting those every 3 weeks. I'll have 6 of those in total. So in total, it'll be about a 4-month course by the time it's all said and done.
So how are they saying the treatments? Do they have any way to ascertain at this point how things are looking as you're getting these chemo treatments?
No, thanks for the question. The biggest way to tell is that my PSA, which is not always a perfect indicator of disease volume with prostate cancer, but it's a pretty reliable indicator.
And a good indicator for you.
Yeah, true, because mine does behave pretty true to form. So that has dropped from 30.6 to 13.6.
Wonderful.
So I'm about 60% of the way down, I guess you'd say,
Woo.
and hopefully with more to come. So so there's one of the things that has happened with mine is that prostate cancer cells have found their way into other places. So, like for example, I love talking about this, and it found their way into my rectal wall. But it's not rectal cancer. It's just prostate cancer cells that are kind of in the rectal wall and creating some complications that are
Close
similar.
proximity makes sense.
Yeah, exactly.
So let's talk about how you've been feeling, because we want to let people know at home, you know what, you've seen and felt the different nuances of your treatments.
Yep.
Starting out feeling like, hey, this is not that bad,
Yeah.
but...
Yeah. So first of all, I guess I would say if you differentiate chemo treatment, which is with it's Taxotere, also called docetaxel, and then if I differentiate that between how I feel after I get the Neulasta. So the first question is, do you think our friends at Amgen would be offended if I ask whether Neulasta is manufactured in hell? Because that's how it makes me feel for several days after I get it.
Yes.
So Neulasta is designed to rebuild your white blood cell count, correct? So Jill, can you quickly explain from a medical perspective what's going on there and why that bone pain is so bad?
Okay, so if you think about it, the white blood cells are manufactured in the bone marrow, which is in the center of most of your bones. And so when you give a medication that is stimulating that production, the factory just starts cranking out white blood cells. Okay. And you're going to notice that in the areas that you have the most density of bone marrows. So iliac crest, or in those like lower back hip bones, the sternum. There have been people who have gotten Neulasta that have gone to the ER thinking that they were having a heart attack from chest pain because of the pain that was in the sternum. Anywhere that you have the more dense bone marrow, typically your long bones, so like your femurs, your upper arms, but because of that, it causes a lot of aching in those areas.
So Jill, I was given the Claritin, and Claritin really, when I was getting my Neulastas, it really did it for me. I really didn't feel this onset of the pain or the achiness that Steve is going through right now. And you say each time, Steve, it's kind of like, getting a little bit more.
Kind of get an accumulative effect. Well, and that you would expect that. Just like with Claritin and people who have allergy symptoms. Claritin doesn't work for everybody for their allergies. So when we give it in the setting of trying to help with bone pain from these bone or white blood cell stimulators, it doesn't work for everybody in that. So Sherry, you were lucky. Steve, sorry about your luck.
But he doesn't have far to go now. You're in the home stretch now.
That's true.
So
turn the corner.
So tell us more about your journey and what you're going through right now.
I always try to focus on the positive. So we were talking right before we came on that if I look at a lot of the symptoms that accompany Taxotere, I do feel fortunate in that I have, I'd say 7 or 8 of them, but there's about 20 I don't have, which is good. So what I have experienced is the severe neutropenia, which is the white blood cell count drop.
That was a medical word, Steve.
I know it was. Alopecia, which is hair loss.
But I do see your hair coming back.
It's coming back.
Yeah,
Dinah says
you got a little peach fuzz up there.
She's not calling me baldy anymore. She calls me fuzzy now. So anyway, but anemia, so the low red blood cell count,
right,
which kind of
goes along with the white blood cells because as we've talked on previous episodes, chemotherapy impacts rapidly dividing cells, and your white blood cells, red blood cells, and platelets all fall into that category. They're the good guys that kind of get caught up in the crossfire.
Yep. And the weird one I told you about is it's for the first couple of days after I get treated is on my right and left side of my tongue it swells, and then I'm like, so I have to be careful not to bite my tongue.
Yeah.
But I don't know. Is it just a reaction to just harsh?
It can be part of the chemo. It can be part of the steroids that you're taking. It can be you have a laundry list of things that could be causing that.
Yeah,
so Jill, what can Steve do at this point? Yeah, I keep just expressing that he needs to get more rest, more rest, and he's like the Energizer Bunny. He wants to go.
100%.
Yeah. So,
and that's the thing that's a little bit different. I tell patients all the time that, chemotherapy does not have to be an end all be all. Like you don't have to lose the ability to do all the things that you love in life. People worry about being able to work full time. Steve, how many hours were you at the Taft on this past Friday working our fundraiser?
I don't know, 10 or so, probably.
Yes, and that was 2 days immediately following chemo.
Yeah.
So it takes a lot more. I bet you would agree with that. It takes a lot more to push through.
It does.
But you definitely are getting it done.
Yeah.
But at a cost.
Yeah, that's true.
So all of us tend I tend to be the team mom and mother everybody. And so I let Steve know when he's looking a little extra wilty.
Okay.
But yes, lots of rest, lots of fluids, eating right. And I would say you have done all of those well, minus the rest.
And Steve, as we wrap this up right now, tell us what is next in your treatment plan.
So I've got 3 more treatments to go. That'll be every 3 weeks, and then of course followed by Neulasta, and then we'll see where we are. But by then, what my expectation is that a significant part of the disease volume will be cleaned out by then.
Hallelujah.
Yeah, and then hopefully I can get at least a year or 2, or maybe if I'm lucky, even a little bit longer than that out of this round, and then we'll just play it by ear. I did want to mention one more fun side effect, which is the sudden and unexplained vomiting.
That's no fun.
Diana now, when she brushes her teeth at night, she has to make sure she's ready to move because 2 times I've nearly thrown up on her while she's brushing her teeth.
Wow.
So and it just comes out of nowhere. But it's not preceded by nausea. I don't feel bad afterwards. It's just blah blah. And
if I was gonna vomit, I would want it to be all of a sudden and out of
just
nowhere,
get it out of there.
and just be done with it, versus having just hours of miserable nausea.
Yes, and I don't have that.
I think maybe this is all happening late at night.
Yeah.
So at least you know it's a nighttime thing.
True.
You don't have to worry
True.
about it during the day, right?
I haven't thrown up on you guys yet.
Well,
No,
we hope
that's
you
good.
And listen, we hope that you don't go there, okay? Yeah, we'll
That
still
would
love
that
you.
would take our friendship to a whole new level.
Okay, we got to wrap this.
You
Steve.
but you are the office mom, and moms do get thrown up on
All
quite
the
a bit.
time. I would probably just, make sure you're taken care of and move right on.
All right. Well, thanks everybody for joining us. We always try to have fun with these things, and it never meant to be cavalier or to make fun of what other people might be experiencing. But you got to have a laugh every now and then. So,
Just keeping it real.
yeah, we'll be back here next week. Chris, what are we talking about next week again? Christy Nelson. Yeah, Christy Nelson. Yeah, hopefully. So anyway, we'll have a great survivor story in here. She's a wonderful, wonderful human being. So anyway, we'll see you back here next Wednesday at noon. Thanks, everybody.